started. So if we want to take it away, feel free.
Okay, welcome everybody. And if you're up for it, would love to see your faces on camera, but totally not a requirement, as I understand. That can being on Zoom all day can be overwhelming. So we're gonna get started, and I don't know, Katie, are you able to do the tech check while we also are letting people in?
Yes, definitely.
Okay, we're gonna start with a tech check and do our roll call and then review our agenda for the day.
Great. Thank you so much, Amy. So just a reminder for everybody, how if you want to select speaker or gallery view and kind of manage your own Zoom settings on your end, please do that. And then at the bottom of the screen, you'll see your mute and unmute and your start video, like Amy mentioned. If you're able to start your video, please do. If not, stay muted unless you would like to speak. And at that point, you'd click raise hand and you'll be called upon to then unmute and share your thoughts. We also have language interpretation and Spanish interpretation available. So everyone does need to make sure to select the interpretation button and then either select the English channel or the Spanish channel. So that is that. If you have any questions from a tech perspective, please don't hesitate to reach out to staff and we can always assist. We'll go ahead and start with a roll call now. Let me make sure I've got everybody co-host. Yes. Oops. So I'm going to go ahead and do roll call. So please just share here or present if you are. We will start with co-chair Michelle Glass.
Present.
Co-chair Amy Fellows.
Here.
Grace Hocob.
Here.
Juan Pablo. And I haven't seen him join yet, so we'll hopefully circle back. Mickey Durding.
Present.
Thank you, Mickey. Colin Stackhouse.
Present.
Thank you. Jensina Hawkins.
Present.
Thank you. Jay Brown.
Present.
Thank you. John Buzzard.
Present.
Thank you. Craig Newton.
I'm here.
Thanks, Craig. Is Yesenia Hernandez?
Present.
Thank you very much. Katie Koenig. Jocelyn Ogden.
Present.
Thank you very much. And then we also have Max Brown on the committee, but he has a previous engagement and was not able to attend today. So thank you all, and I will turn it back to co-chairs.
Great. So we've done the first bullet point and moving into the agenda review. So today we're going to give you an update on the board policies and procedures that were slightly tweaked at our last board meeting. We're going to go over the work plan, check in on the work plan, and hear report back on committee work from staff. Staff has taken at our direction and part of our work plan, a community health assessment landscape overview. So we're going to kind of hear what the common themes of the community health assessments and community health improvement plans that we were able to access across the state. We're going to have a discussion of key takeaways from community input presentation, community engagement overview and planning discussion, communications overview and planning discussion, and meeting reflections and future topics. And I understand that we have had nobody request to do public comment today. So we can move into the first agenda item.
Thanks, Co-Chair Fellows. Good morning, everyone. Michelle Glass, she, her pronouns. Want to start today with a quick update to share with you all. As we've discussed previously, we are a subcommittee of the Universal Health Plan Governance Board, and as such, our entire committee and all of us as members and all of our work is subject to the board's policies and procedures. So we want to be really transparent and make sure that you know of any changes to those policies and procedures, which we've gone over before, as a committee. So at our November 21st Universal Health Plan Governance Board meeting, we did have an executive session with our legal counsel, Jake Gill, and talked about some updated guidance from the Oregon Ethics Commission, and how the new updates to Oregon public meeting law is being interpreted and implemented. And so basically, when we came out of executive session, the board did move to amend our policies and procedures. Basically, the policies and procedures we started with were the most conservative and careful and restrictive version of interpreting the update to public meeting law. And we amended our policies and procedures to still be in strong compliance in the spirit of transparency and in the letter of the law, but to give us a little bit more clarity on how we can communicate with each other in this work. And so what you see bolded, thank you so much, staff, for bolding the sections that were changed, is what was changed it's the new language, essentially. So the main concern here is that communication in between these meetings, these big public meetings that are recorded and put online, if I were to call Jensina, and then Jensina were to call John, and John were to call Jocelyn, we could quickly get to a quorum, and that would be a violation of public meeting law. So that's what we were trying to avoid, and what we're still trying to avoid. What we've clarified is that we can call each other as long as we are very clear and very careful that we are not reaching that serial quorum. So now the policy reads, communications among less than a quorum of the board is permitted. And this, anything, again, when it says board, it also applies to us as a committee. So we will not create serial communication. We won't play any telephone games. And we will make sure that we are, clearly understanding how that could happen and what that means. And so what I would say is, if you have a specific question about how this works, please reach out to Amy and I or staff, that email address that you've been using. Because again, any one of us that's in violation of this puts this work at peril, and also the public trust, which we really care about. So it is now okay to give someone a phone call. If there's something you really need to understand better, or you have a question, or you want to raise a concern, you can bring those to these meetings. You can also reach out to Amy or myself or a fellow board member. But again, if that were to happen, you need to make sure that that doesn't become then that person calls another person and that person calls another person, or you call 3 people on the board, that sort of thing. So do folks have any questions about that? Okay.
Michelle, I was wondering, because quorums are based on numbers, if should we, what is a quorum for this committee?
Yeah, this committee has 14 members. So it would be 7. Is that right?
Or 8? Is it? Staff, help us. Is it 7 or 8?
It would be 8.
It would be 8. Okay.
Thank you. All right, great. So now that we have that exciting piece of business out of the way, I will pass it to Jenny.
Thanks, Michelle. So we've heard from committee members and from board members that it's really important to continue to look back, because we cover in the first meeting generally what our tasks and deliverables are, but to keep looking back at that and reminding ourselves of the work that we're here to accomplish. Katie, you can go to the next slide. And we just want to do a little bit of a review during this meeting. This is our third meeting of what our tasks and deliverables are for community engagement and communications, and then just take a look at what the committee has accomplished so far so that we know that what we're looking forward to. And so just a little bit of a reminder around our tasks and deliverables. One of our first tasks is to review the Joint Task Force final report on community engagement, which we did with Devlin Prince in our first meeting. To identify strategies to engage with community and stakeholders using existing structures and meetings. And we've started to collect that information from committee members, and some of that information is still coming in as we're building that list. To engage with key partners, including federally recognized tribes, businesses, providers, clinics, CCOs, community-based organizations, disability-led organizations, and insurance carriers. And that's something that we're going to start building toward a plan for in this meeting and in future meetings. Develop a plan for general public outreach. Again, that's something else that we're going to be looking for and planning for. And this particular task is related to the Finance and Operations Committee, which is underway, and which we'll be looking for them to report back to us, give us some information so that we can go out and share that with the community and get better input from the community on the work that they're doing. Engage with small and large business, particularly in the development of the revenue and finance development of the Universal Health Plan. Again, we'll be looking for some work to come out of the Finance and Revenue and the Plan Design Committees to take that in and create our plan for going out and getting community outreach there. So that's not something we've started yet. And present feedback received through community engagements back to the board. And again, that's something we'll be looking at in the future as we start to do that actual engagement. The deliverables we have are using existing mechanisms, which we've started to collect. Community engagement for plans for businesses, healthcare industry, and healthcare consumers. That's something that we'll start working on with the help of Diana Bianca today. And at a minimum, present workstream recommendations. And again, that'll be something as part of the plan that we'll be creating. Next slide. For communications, slightly shorter list, but still very important work. And we'll identify communication materials needed to develop strategies for using the materials. That's already started to happen within the committee with some of the recommendations that have been made. Identify the best messages to communicate the value of the Universal Health Plan. That's something that we've started to talk about, but we'll look to both the internal team here at DCBS and bringing on an additional contractor to help us develop those messages. And then the deliverables of developing the communications plan, putting out those presentations, and creating the dissemination plan is something that we'll start to develop as we start to move in. Once the plan is actually being designed and we have things to share with the community, that'll be something we start to work on. Next slide. So to look at what we've accomplished thus far, as I said, we've had a presentation on the review of the Joint Task Force community engagement. We've had a great presentation from committee members, actually, from the Oregon Advocacy Commission on their HB 4052 engagement work. Today, we'll be looking at an overview of community health assessments and the information that they've collected from the public in those assessments. I will be presenting on the key themes from those, and we've kind of put together the key themes from today's presentation and the previous presentations about what is it that we're seeing from the community input that already exists. And then we've started identifying those existing meetings and structures. In terms of communications, like I said, the committee's already organically started to come up with ideas for communications and outreach documents that we could be generating, including instruction for public testimony and a one-page fact sheet that is accessible in different languages and that uses plain language. And so that's where we're sort of at right now as a committee, some of the work that we've already done, where we're going to be heading. Today, we have a presentation from Diana on community outreach. We have a presentation from Mark Peterson from DCBS on communications. And so we'll start to get some of that information as we start to look towards building those plans. So next slide, Katie. So as I said, I did an overview.
Oh, sorry, Jenny. I just was wondering if we should pause and ask if there's any questions before we move into the next part. Are there any questions on what Jenny just covered? Okay, it's fine if there's not. I just wanted to make sure, like, before we dig into community health assessments.
So like Michelle said, Amy said at the beginning, I did an overview of community health assessments, looking at health assessments that have been collected from all over the state. Katie, you can go to the next slide. So for those of you who aren't familiar with them, all of you may be, but I wasn't before I started doing some of this work. So community health assessments identify key health needs and issues through systematic, comprehensive data collection and analysis. So everywhere in the state, either the CCO for the region, in partnership with other organizations in their area, does extensive surveying and outreach to the community to get input on what is affecting the health of their community. And it's not just, visiting your general practitioner. It's a very broad, expansive look at what is the health factors impacting the community. Once they've created that and collected that information, they're required to put together a community health improvement plan, which are also identified as CHIPs, not just CHPs. And these are long-term plans to help address what they're finding in the community health assessments. CCOs are required to do these, to collect this information and put together these community health improvement plans every 5 years. That being said, some of the reports were created in 2019 and are being updated this year. The work is being done this year. When I started looking at community health assessments from around the state, generally those that were created in 2019, I didn't do as much, I didn't look into them as deeply and didn't really take the information out of those to really look at some of the trends, because as we all know, since 2019, a lot of things in the health environment and in the state generally have changed pretty dramatically after the pandemic. Although I will say that even some of the reports from 2019 that I did take a look at, a lot of the themes still carry through. Go to the next slide. So I was able to access an assessment from almost every county in the state. Like I said, the ones that were from 2019, I didn't necessarily review all of those. I looked through some of them to see if the trends were a little bit the same, but these are all of the reports that I actually did a complete review of and looked through all of the information that was collected as part of the assessment. I made sure to look at each area of the state and see if I could get information from every region of the state so that it was more representative of all the population of the state. Next slide. And so in community health assessments, they have information sources that are primary and secondary, and those primary sources are the community themselves. So focus groups, community surveys, and key informants from the community are the primary sources of information for the community health assessments. They also use federal data collections, state data collections, county records, and former community health assessments to collect some of the information. But again, primarily the information is coming from the people of the state. They collect demographic information. They collect information on social determinants of health, health behaviors, health outcomes, and access to health care. Next slide. And so looking at all of these different regions around the state, all of the different counties and the information that came out, it was absolutely true that the number one thing that most people in the state reported on in community health assessments was housing and mental and behavioral health access. The other categories that I've included here were always at the top, but housing and mental and behavioral health access were really the two that stood out as number one in almost all of the number one and two, kind of back and forth in all of the community health assessments. And housing based on affordable housing, what's available in housing, and addressing homelessness. Mental and behavioral health in access to providers, and in the stigma around reaching out for mental and behavioral health access. Also coming in, which was often a topic, not generally at the top as often as housing and mental and behavioral health, but physical health care, primarily access and affordability, which is something that I think we're all familiar with in doing the work of this committee and this board. Also access to dental or coverage of dental and vision. Food and nutrition were also something that was universal around the state, particularly food insecurity, but also access and affordability of healthy foods. Excuse me. Substance use came up quite a bit in all of the different reports as well. Economic security, both in terms of access to healthcare and the costs of healthcare, but also general economic security in their community. A lot of times this also related to housing. And then environmental factors, primarily the one most talked about was wildfires in terms of air quality, in terms of housing, and in terms of increased pricing and affordability in communities that have been affected by wildfires. So these are the primary takeaways from the community health assessments that I reviewed. And again, they have a little bit of difference in terms of the years that they were created. Most of them were created between 2020 and 2022, the ones that I looked at. So we'll be seeing a new batch coming out probably within the next year or so. Mickey?
This might just be my ignorance, but I thought that behavioral health umbrella covers both mental health issues and substance use disorder. So seeing them separately, I wonder if maybe substance use goes under behavioral health and that it should be number 2 as well. I'm not sure.
I think and I would have to look into, and I think this might be a question for if there's anyone else who has a lot of experience with community health assessments, but because the outreach is given to the community itself, I think that it's ranked in terms of how the community reports back on it. And if the community separates out mental and behavioral health from substance use supports that they feel their community needs, they might be separated. Jensina.
Okay, got it. Thank you.
From a medical standpoint, they're actually separate as well. Substance use disorder is a different kind of diagnosis and treatment, and as far as how the treatment is performed and the documentation and the segregation from other regular medical care is different from mental and behavioral health.
Thanks.
Yeah, it's the federal government and streaming funds where they made that umbrella of behavioral health, and then all of the departments. And I wanted to cry the day that the signs changed from mental health to behavioral health, but another time. Jay.
When it comes down to billing for us on our end, working in the IDD field, we can bill differently depending on like where it comes down, like funding wise. So just wanted to add that.
Thank you. And for folks in the Tri-County Portland Metro area, I need to double check and I'll send it to staff to send out, but I believe they are still collecting community input. I saw an email in the last couple of weeks about that, so I will send that to staff to share out if you want to like participate and give feedback if you live in Washington, Multnomah, or Clackamas. I think it actually includes Clark County too.
And if anyone would like me to provide the reports that I reviewed, they're not incredibly difficult to find, but they're not always where you expect them to be. If anyone was interested in taking a look at the reports that I found, I could share with the committee a file with all of the reports that I reviewed for this, if that would be helpful or useful to anyone. Colin, go ahead.
That sounds interesting. So yeah, sure. My question is, are the community health assessments, do they vary in their questioning or how it's presented per geographic area or like per CCO? Or is it like a blanket identical assessment that's sort of offered to every patient? Or did you have to sort of tease out the similarities?
They're pretty uniform. And from what I understand, there are requirements around what has to be in a community health assessment, what questions need to be asked and what information needs to be collected. And they're pretty easy once you start reviewing a lot of them to start to understand exactly where the community health information is and where the community input sections are and what questions were asked of the community. And they're pretty uniform. That's a great question. Thanks.
And Michelle or somebody correct me if I'm saying this wrong, but I know that county public health or public health districts in some of our counties that don't actually have public health departments anymore, I believe are more heavily involved. Is it in the child part? I don't remember. I just remember like one of them is more heavily public health involved, and then the others are kind of more heavily the CCO and hospitals. but then usually they're all working together, but they kind of have different pieces, and I'm not explaining it well, but I just wanted to make sure that folks knew that public health departments are involved as well.
Yeah, that's absolutely correct. And I think public health departments also have requirements for participation. In our region, they're the backbone agent, one of the backbone agencies for the CHA, the community health assessment. I would say one thing that does vary, although it is standardized, and part of that is for data reasons. So we have useful data across the state and can look at health disparities and things like that. But there is some regional variation, to your point, Colin. And one of the things that really changes the flavor is the partners at the table. So in some communities, there are a lot more community-based and culturally specific organizations participating in the outreach and the design of the survey instruments and things like that. And that can really increase participation from a much more diverse set of community members, rather than if it's just the hospitals or just the CCOs or just public health doing it. So that's one piece that I think really depends on the region.
Any other questions or comments?
Yeah, I would just add how I saw that the Tri-County area is doing it is that Oregon Health Equity Alliance, which is the Tri-County Regional Health Equity Coalition, was sending it out. And I think they used to have a contract to be involved. I don't know if they do this time, but sometimes the Regional Health Equity Coalitions get involved for the community engagement piece or other CBOs, like Michelle said, to make sure that they are getting populations that often got left behind in the past.
Thanks, Amy. Any other questions? Okay, and like I said, this was a pretty broad overview of the landscape of what we see from the community health assessments. And so taking that into consideration and looking at what the key takeaways are from the presentations that we've seen thus far and the input that we've put together that's already been collected from community members, we wanted to do a little bit of a conversation around what we've already seen. And I'll hand it over to Amy to lead our discussion.
All right, next slide, Katie. So here are some of the key takeaways that we have heard through our various presentations and data gathering. So we're looking at community alignment with the Joint Task Force policy recommendations. So we are in alignment in terms of access and affordability being topics, comprehensive benefits, eligibility and enrollment, provider reimbursement, equity, and social determinants of health. We have partial alignment around ERISA, which is the federal requirement that requires, help me staff if I say it wrong, employers to offer health insurance. And then has regulations around that. That is going to be one of the tricky things we're going to be needing to navigate as we try to move this work forward. Governance, patient safety and quality, private commercial insurers, and regional involvement. And then where we have opportunities for alignment is looking at costs and proposed tax rates, looking at farming and agriculture, implementation risk, Medicare enrollees. Some of the most public comment we get are people concerned that are Medicare enrollees, multi-state employers, workforce, and community engagement with transition and implementation of our plan. Next slide. Okay, so from the Oregon Advocacy Commission that we heard from our fellow member Grace. These, I don't know if I want to read all of these again for you, but you can see here the key takeaways, included BIPOC community health workers, bilingual provider salary increases, emergency response for rural and frontier, affordable counseling services, mental health education, healthcare sanctuary for immigrants, healthcare education advocates, mobile health unit, units, increased healthcare access, nutrition education, linguistically and culturally specific healthcare services. I'm sorry, Jenny, go ahead.
That's okay.
Oh.
I just want to point out, as I was putting this information together, I know that Grace and the team from Oregon Advocacy Commission really presented on a few of their topics, but in looking at their materials, the input that they received and the work that they did was so rich that I wanted to be sure that we really looked at the full breadth of the information that they collected and their full report on what they received back. And Grace, if you want to comment on any of this, we would absolutely welcome it. But really wanted to include really the key takeaways that they got even outside the presentation that they provided to us, because they really did collect such a wealth of really rich information that I didn't want to leave anything out.
I'll jump in and say I don't have anything else to add. I think this is a perfect list. There is 100 recommendations, so you're definitely not going to touch on every single one, but there are definitely some that I've heard stand out a lot more than others. And I would say, for example, the top 3 are very pointed to that, especially the BIPOC community health workers and the general language access. So yeah, great list. Thank you.
Thanks, Grace. Next slide. And then what you just saw from what Jenny presented. And then I think the next slide has some conversation questions.
It doesn't. The next slide is.
Oh, it doesn't. Oh, okay. Oh, okay. So I don't know, Jenny, do you want to help us kind of connect the dots on this?
And so what we're looking at here is, now that we've created, as we've met one of our tasks to really take a deep look at the information that's already existed out in the community, that's already been collected from the community, and where they've been asked to give input on the needs of the community around health and how we should be looking at moving forward healthcare in the state. And as the Community Engagement and Communications Committee, we didn't want to repeat all of that work. We really wanted to bring in what's already been done and not go out and ask the community once again to give us just their input without being able to report back what we were working on. And so what we want to do as a committee at this point is say, what is it that we as the Community Engagement Committee find important and useful and necessary to pass on possibly to the board to say, we've collected all this information. This is what we want you, the board, to do with it. We have the option at this point to make a recommendation to the board to say, as you're creating this plan, as your plan design committee is working, as your finance and revenue committee is working, it's important that these committees be aware of this information that the Community Engagement and Communications Committee has reviewed and looked at and had discussions about. This is what we have found that the community is talking the most about in healthcare, and that you need to be most aware of. Michelle, did you want to add to that?
I think that's thanks, Co-Chair Fellows, and thanks, Jenny. I think we just wanted to circle back to all of you. We've done such great collective discussion and brainstorming in our first few sessions, and see, like, what do you all think? Do you think that there's anything missing? What do you think about the idea of bringing this as a recommendation to the board? That, we bring this to the board with a recommendation that these key themes be sent to the operations committee, plan design committee, as a starting point, since this is, the first part of our work plan was conducting this scan. Or what other ideas do you have? So really opening a brainstorm and an open discussion is I think what we're hoping for.
Mickey.
Thank you so much for all this work. It's great. I'm aligned with making that recommendation. Is it this one as well as the one that Grace, Oregon Advocacy Commission submitted? Or just this one?
So it would be taking a look at all 3, all of the information that we've collected thus far and reviewed.
Oh, okay. Yes, please. I'm aligned.
Any other comments or questions about making a recommendation to the board? Is it Adriana or Adriana?
Fortunately, members of the public aren't able to connect their audio.
Oh, okay. Oh, is
Yeah.
that okay?
But Adriana, thank you very much for your comment. Please feel free to email uhpgb.info@dcbs.oregon.gov, and your question or comment will definitely be addressed and sent to committee chairs.
Thanks, Katie.
Colin?
I echo Mickey. I'm also aligned with these putting forth this framework and like the sort of list of all the work that's already been done. I don't know, so I'm asking, but is there a way to go further than just the recommendation as far as like saying housing is a problem, or do we have the capacity to say anything else, or what are that's such a huge problem that's related to so many things besides health. But yeah, so like are we, I'm just curious how we will present that to the other other committees.
Or I kind of hear in that question maybe like maybe some sort of prioritization, or yeah, I mean, okay, Jensina and then Craig.
I would be curious if there was anything different from what was in the task force recommendation, or if there were any surprises with the community input that wasn't included in the task force recommendation.
That's a really great question, Jensina. And I will say off the top of my head, I don't think that there's anything that was not part of the task force recommendation that we saw come out in other areas explicitly. I think the social determinants of health being part of where the task force was, Katie, can you go back to the joint task force slide, 2 slides previous? Thank you. Where the community was aligned with the task force looking at social determinants of health encompasses in some ways some of the other information that we see coming out in the community health assessment reports and in the work of the Oregon Advocacy Commission, but I'm not sure that it was, that at least in what we've reviewed wasn't as detailed, and possibly in what I don't think the governance board has really looked at the details of what the community engagement and outreach from the joint task force included. So if we wanted to include in the information and recommendation that we send forward that looking at social determinants of health was something that the task force was aligned with the community on, and here's what the community engagement and communications committee sees as the priorities or the most prominent areas of social determinants of health that are aligned with what the task force did, we could possibly do that.
And I would add something that had jumped out to me and I asked kind of in our preparation meeting about is we saw on the Chip Chaw slide dental and vision, and those are areas that I believe the joint task force did address, right? And so when we're talking about plan design and considering if anybody here is either on OHP or knows an adult on OHP, how the dental situation with the huge limitations, or even if you are paying for your own dental insurance, and like that's a big area that doesn't addressed in our current system very, very well, and has a huge impact on health. That somehow we still separate what's happening with our teeth from health. So that's just an example. Craig.
Oh, excuse me. Thank you. Give me just a second here to, I'm just going to talk just for a second. I agree with all the information we have here. It's better to have more information than too little. I completely understand the housing component and so on. We have it down here at Jackson Care Connect. That's one of our 4 areas that we specifically have been looking at. I know how important that is. This is a long setup to my question. So here's my question. When I think of universal health care, I think of medical, dental, and vision. And what I'm getting at is I'm trying to think of at what the Canadian model is like, or the Great Britain model. It's going to be a heavy lift just to get those three things covered: medical, dental, and vision. If vision is going to be covered, here's my point. It's going to be a heavy lift to ask the citizens of Oregon to say, I don't understand the housing component, how that's going to, if is the health plan, I know I'm this is way out of my league and this is way down the line, but is the housing component part of the Oregon proposal for universal health care coverage? In other words, I just think of the three things: medical, vision, dental, and that's going to be hard enough to get pushed forward. And I worry with all these additional things, how the public's going to react. I hope my question kind of made sense. Thank you.
I think that makes your question makes a lot of sense. I think one thing I want to throw out here for all of us to think about is our role is to listen and to share information. I worry that if we start deciding what to pass along and what not to pass along, then we're gatekeeping a little bit. So to me, it's like, if this is what rose up in community feedback, we are the plan design committee. That the plan design committee will wrestle with the community feedback, and that's their role in this. But I want to make sure that we don't start doing too much interpretation of feasibility, and then how does that change the taxing structure? Like that is plan design. That is the finance committee's role, is to wrestle with those pieces. And it is true, we cannot do everything that needs to be done. Probably that is probably true. But I also want to make sure that, I think if we were getting a request from another committee, I would hope that they would leave it up to us how to design the community engagement or how to do the communications work. So I guess I want to honor the feedback that's been given, and then trust the other committees that also have amazing, smart volunteers from across the state, like all of you, to do those pieces of the work. And I don't feel like that's within our role or scope or responsibility. And so I just want to throw that out for consideration. Like, I think my question in looking at this is like, is this a good representation of the feedback that we have gathered in our scan? And do folks feel good about sending that to the board with the recommendation that it go to plan design to inform that? No, just saying, we're not telling you what to include or not include. We're telling you we just did a scan of the last few years of community feedback related to health and what priorities folks have. And this is what we heard. And not going beyond that. So curious, like, how that lands for folks.
Craig,
Yeah,
go ahead.
I agree with that. My intention wasn't to eliminate things or stifle. I didn't mean that at all. I would just I just kind of spitballing, just kind of talking, sharing things. That's all I was doing. No, but I think it's an excellent list, and I will. I back it up. I approve it. Thank you.
I think it was a really important question, Craig, for us to talk about and think through. So, because yes, I don't think necessarily we can solve the housing crisis through the work of the board. But like Michelle said, it's just giving them information about things that are impacting people's health. And did I see Mickey's hand go up?
Oh, I was just going to offer, but if you wanted to tie in how that's related, there's a really great Medicaid waiver information called it's HRSN, and I'll share with you, for example, when somebody's in the hospital and they have Medicaid waiver, they could actually get a prescription to get funding for rent or something for 6 months if there's some sort of medical disability for the next 6 months. That's kind of like how it's related. I'm not doing a good job of articulating it, but just in case you wanted to connect the dots that way, Oregon Health Authority has information on that. It's called Medicaid Waiver 115 Housing Supports.
Yeah, I think that's really important for connecting those dots. And you know, we see here that the task force was talking about social determinants of health. And we do know that in Oregon, like Mickey just pointed out that one example, there's been a lot of work done for folks who get Oregon Health Plan or involved in CCOs, the whole flexible spending. I'm sure a lot of you remember former Governor Kitzhaber and his air conditioner story, right? About providing air conditioners for somebody that continued to go into the emergency room that I believe was an older person with heart issues. And then if a air and you know, overheating was causing that. And so by providing an air conditioner, you are providing healthcare in a way and preventing unnecessary, you know, emergency room visits. So we want to, I think one of the things we want to like kind of, we don't want to go backwards, I guess is what I'm saying, you know, in some of those areas where the state has been innovative and done good work in looking at non-traditional things that do impact health. Any other questions or comments before we move on to Diana Bianco's presentation, our community engagement consultant? Go ahead, Jen.
I just wanted to say I can put something together for the committee to review at the next meeting. We are working on a proposal form for committees to share up to the board, and that should be ready, and we'll probably be the first committee to use it, which isn't surprising. They wanted us to start first for a reason. And so I can put that together and we can take a look at it at the next meeting and have a conversation if it contains everything that the committee wants to raise up to the board, and just review it at that point, if that's okay with everyone. Okay.
Grace.
Thank you. And yes, that sounds good. I am in support of moving forward the topics that were presented. I did want to mention, although this may not fall into a specific topic, it more so, sorry if it's in the weeds, but does interweave into all of the topics of the need for cultural specificity and language access is something that I feel is interwoven into each of those buckets. And it's something that I've been hearing a lot, especially even if it is, for example, mandated at the state, sometimes the support that is needed for interpretation or language materials is not always fully there, especially for small agencies. It's a harder administrative burden. So I just wanted to point that out.
Thanks, Grace. Anything else before we move on to Diana?
Just as a quick point of excitement, that's not in the Robert's Rules of Order, but it's okay. I just wanted to share that I was so shocked and pleasantly surprised that the Jackson and Josephine County Community Health Assessment this year included one of the themes that rose up in terms of what the community wants to see to improve community health was universal health care. So great work, y'all. It's percolating up from community feedback. And I thought that was fascinating that was some of the feedback that was given as part of the trial. So just a note.
Nice. Okay, I think we're ready to for Diana's presentation.
Hi folks, Diana Bianco, she, her pronouns, Artemis Consulting, and I was had the privilege of being with all of you last month just to sort of do an overall hello, and this is sort of what we're doing, and I'm here today to have more of a discussion with all of you. So if we could go to the next slide. So here's what I hope we can do, and I think if I'm right, we have until about 1:20 or so. And I'm hoping most of that time is actually going to be me hearing from all of you. So I just want to go over briefly the scope of work, and hopefully y'all have had a chance to look at the slides. So I'm not going to spend a ton of time, but we'll answer any questions, share sort of an overall approach, talk about some key components for a successful process, and then hear from all of you. And I have a set of questions there. If you go to the next slide. One of the things that I was struck by, and I've been on the call since you all started, was there's a number of tasks and deliverables that you have under community engagement. I am responsible for a chunk of those, not all of those. And so I'm going to keep coming back to sort of wanting to be sure that you all get what you need, but also sort of that we're focused in terms of what my chunk of work is. And it's not that's not because I'm like, I'm not going to do that because that's not in my contract. It's more because I want to be sure you have the right expertise and the right folks doing the work when you do that work. So I'm really focused on a couple things that are required in the legislation. And I'll be doing a community engagement plan for this list of folks here. So just this list is different than, though not exclusive from, a broader public engagement strategy, right? So I'm not the person who's going to go out and do big public meetings. And I don't know exactly what your plans are for that, but these are going to be really targeted engagement opportunities. Focus that are required by the legislation. So that's the first thing. And then if we go to the next slide, too many words on this slide, I know. Hopefully folks can actually take a look, but it really is just to give you, again, a sense of what I've been asked to do, and I see all of this, y'all, as doing this in partnership with all of you. Right. So you can see that we're calling it sort of specialty forum meetings, working with all of you to identify stakeholder groups. I know that you've already started that process. I listened in on, I think, part of your meeting last month where you looked at a list on a spreadsheet, sort of helping to figure out how do we use existing groups to get some of this information. In consultation with all of you, that's how this is done. I'll be facilitating those. We'll work to sort of help the group summarize and then get it back to you. So before I move on, those two slides in terms of the scope, let me see, and again, I know there's a lot of words here, but any questions about the scope?
Can maybe just take a couple minutes for folks to read.
Absolutely. I know there's a lot. And the slide before, hopefully folks also have that accessible. I couldn't put it all on one slide because that would be impossible to read.
And I think folks know, but on the agenda, there's hyperlinks for each agenda item that has its own presentation or background information. So for item 6 that we're on, you can kind of go back and forward on your own if you need to do that. Or review it later and send in information.
Absolutely. I'm not going to just be here and never answer another question unless I'm with all of you. So I'm happy to give you my email and you can reach out as well. So if we go to the next slide, and again, happy to answer questions if in a few minutes you're like, oh, I just looked and. So the overall approach is, and we have a slide in a moment, about being clear about the goals for engaging these groups. Oh, Jensina, please.
Hi, Diana. That scope of work, is that your scope of work as a consultant working with us or our scope of work as the committee?
Mine. Perfect question. My scope of work.
Thank you very much.
Absolutely. Yeah, you all have tasks and deliverables that are much broader than that, but I appreciate that clarification. So, just as an FYI, and I should have put this on, my contract is through 2025. So this is not like happening in the first 3 months of 2025. This is, and I'll talk in a minute about some of the dependencies on this work, or the interdependencies. So this is going to take a bit of time. So overall approach. Affirming the goals, we'll talk about that in a moment. You already have started to compile a list of groups that we hope to engage, and I'm going to talk a little bit about some of the trade-offs there. We need to think about a setting and approach for different groups. We expect most of this is going to be virtual, but maybe there are some situations where it makes sense to do in person. I'll be working on a community engagement plan that will be a process by which I share it with you. You all give me feedback. I'll be working with your co-chairs and board staff on this. So again, and that's not how I do business, is sort of go off and do my own thing, but it is in partnership with all of you. Coordinating with other board committees. Now, this is one of the things I meant when I talked about dependencies. So we need questions to bring to these groups. We need some targeted, and I'll talk about that in a moment, crisp, sort of give us feedback on this, or this, as opposed to, what do y'all think about universal health? And so we want to be really strategic and mindful. And what that means is we may have to wait on some of this till we have some proposals from other board committees. And obviously, as I said, ongoing consultation with all of you. So here's some ideas, and I have a specific question for all of you about this in a moment. But I've been doing this work for a long time, and this is some of the things that I think are important and want to be sure I'm capturing your input too. But we really want this to be meaningful engagement. We don't want this to be sort of, okay, we talked to those 5 groups, check, done, but really want it to be meaningful. We want to create an inclusive space, and what that looks like may vary across groups. We want to encourage participation from everybody who attends and have open communication, trust, and respect. And sometimes, that's a little harder to do, to build that kind of trust in one-off sessions. So I want to recognize that. We want to ask crisp questions and send them in advance so folks could be, thinking about them. We want to provide information. How is this going to be shared and utilized? Want to acknowledge both that there's really good things about virtual sessions and some hard things too. This is a key one. I mentioned this when we talked last month, that there are capacity and resource limitations, but we also want to sort of get as much participation and input as we can. So we're going to have to balance that, and there's going to be some trade-offs. And again, coordination with other board committees. And then, as I mentioned, this work is only part of your tasks, but it's a chunk of it. So I'm gonna ask you some questions about adding to this list. But do folks have any questions for me before we get to comments from all of you? Okay, so if we go to the next slide, so this is very specific, and I'm glad I've listened to at least last month's meeting and tuned in earlier, because I think there's this key piece here that what you all are doing, and this is what the legislature has asked you to do, is gather input and inform. Nobody's trying to, at this point, the task is not to convince folks of this proposal or that proposal, but it really is to say, here's a proposal, and then have a series of questions about it, and then gather all that input and identify themes. That's just as you've just had this presentation on the CHA and the Oregon Advocacy Commission, like, what are the big themes that you're hearing? And so that we're going to be balancing all this input we get with what are the major themes. And then there might be some things, well, we didn't hear it from a ton of people, but wow, that's a really interesting perspective, and maybe we should lift that up. Or that goes to this other question that we haven't heard from anybody else. Let's lift that up. So we're going to be working on that, but really we're gathering input. Does anybody have questions about those goals? Because those are really, want to affirm that that's what we're doing here. Jensina, please.
I'm squeaky wheel today. I would love to see this as in perspective to timelines. One thing that is a little bit alarming to me is that we've spent so much time as a committee having meetings and receiving presentations, but we haven't really been deployed yet to actually gather this input or provide community information. And so I would love to see things as far as, when do we anticipate actually being boots on the ground for this?
Amy has her hands up, so she may have give a
I
response.
don't have a concrete response, but part of my response is that we are interdependent with the other committees. So the plan design committee has to give us a draft plan for us to get input and feedback on. And so the feedback loop between the committees is part of that. So I do think, Jennifer, what I hear in that question though, I think is important. And maybe we can figure out a way to work with the committees on kind of their timelines and deliverables. I mean, I think we have like, I know we have kind of a big beginning overview that we used kind of before the committees really took off, but like that being a working document so we can continue to come back to it as, you know, as the plan design work takes off and the finance and revenue work takes off, I think would be helpful for everybody, you know, knowing that it's things may adjust or shift as the work gets meatier, if that makes sense. I'll let you respond more.
Thank you for that question, Jensina and Amy. I think that that's a great point. I think maybe we could bring back in the next committee a review of the timeline and maybe enhance that a little bit from the first time we looked at what the committee timelines are with some information from the work plans that the board and staff have put together to anticipate when some of the proposals might be coming out. I think it's important to remember though that as plan design and finance are doing the work, they're going to have to create a proposal. That proposal is going to have to go up to the board for the board to say, yes, this is something that we want you to go out and get feedback on. This is something that we're okay with you moving forward with. And so there is an aspect to this committee and really the interplay between all the committees that is going to require a little bit of waiting time. I do think that for us, being able to make this first recommendation around some of the things that we want to highlight to the board is a good first step. And then really having some time to put together an engagement plan and a communications plan that we might be able to work a little bit more on in terms of putting out some messaging about what the board is doing and what the board is engaged in at this point might be some steps that we could take in the interim. And maybe we could talk about a little bit more about that when we get to the part later in the meeting where we talk about next meeting topics and steps. But thanks, and I can bring that information back for the next meeting.
And I'll just chime in, and then I see, Colin, that you have your hand up, is what I hope is that we've done work together so that we are ready to go, right? So as soon as the board says, yes, this is an idea, that we are like, okay, let's get these scheduled. We know the 10 groups, we know the structure, we know, you know, that, and then we can create the questions, but we've done all the prep work that we're able to do. That's what I'm hopeful about. Colin, go ahead.
To respond to Jensina about, or I like the idea of getting boots on the ground, and I think we all have our own boots and our own ground that, you know, we're working in. But I've been at least like referring to the work of the joint task force and like that document, which is sort of the frame, I call it the blueprint or like the framework for the work that the current governance board is working from. And so I just want to confirm that it's a-okay for us to say there's this great framework and things are, it's 2 years later, things are changing, things are updated. So yeah, that's fine, right?
Go ahead, Michelle.
That's such a great point. That is fine, and that is part of this evolution. I will say, and maybe we can send this out after the meeting, because it has been a couple of years and things have changed. The board did some work reviewing the framework from the task force and adopting a starting point framework from the task force recommendations. And so that is the most up-to-date version of that, and it's a little shorter. So just to share that exists. But yes, the framework is also a great document that's available and shareable, and you know, the origin of this work, or the starting point for this work.
Thank you. Okay, so if we could go to the next slide, and then I'm going to ask us to pop back up, because this first question are I listed some key components for success in engaging these groups, but I'd really love to hear if you have any additions. So the question is, what are additional key components for success in engaging the groups? And then if we just go up back a couple of slides to those key components, I'm asking if there's anything that you feel, oh, we've missed this or this. Is there any sort of key component that you think is really important that isn't reflected here? Let's start with Colin, then Grace.
Hi again. I don't see anything. Well, creating an inclusive space is like similar to this point, but trying to meet people where they are and not make people come to that inclusive space, but go to other people's inclusive spaces.
Love that. Yep. Thank you. Grace, please.
Thank you. With recognition, to the point saying recognizing capacity and resource limitations, I also do want to uplift that paying people for their lived experience and the time that they contribute is an important aspect, at least from what I've gathered in my work. And yeah, I think that should be uplifted if there is resources available for that. But obviously, but I understand that there's going to be a lot of community engagement groups, so that may not be a plan that is able to be duplicated, but maybe for bigger events or things that actually have to do with touching more vulnerable experiences. I think that's an important aspect.
I really appreciate that. And I don't know, Grace, if that's in the budget, but can certainly take a look at, and I can find that out for sure. And maybe Amy knows because her hand went up fast. Go ahead, Amy.
Oh, staff will need to answer the budget question. I was just thinking the same thing. I just wanted to, while I'm thinking of it, because it seems pertinent to this, an opportunity next week that I will have staff send out an email that I saw is that there is a OHA sponsored listening session for OHP members to give feedback on CCOs. And if that's something that anyone in the group is interested in, it could give us some more data and input and listening to, how people feel about their current OHP CCO plan, because again, the starting point of the plan design will likely fall somewhere between our current OHP setup and PEB, the public employees benefits. So really having awareness and knowledge about, how is what we currently have for OHP working for people might help inform. That's all. And I will send that information out.
Thank you. Jocelyn, please.
Oh, I just was wondering when that will be, but thanks, Amy, for sending that out.
I think it's on the 12th. Yeah. I can find it before the end of the meeting and give the time just if people want to hold their calendars.
Other comments? Mark. Oh, no, sorry. I was wrong about that. I saw somebody come in the waiting room and I was so excited. I thought they raised their hands. Any other comments? And again, if you all look at this and you wanna, I don't think I can chat, but I'm happy to have, for you all to have my email to let me know. Unless it should go through the co-chairs. Yes, Michelle is saying go through the co-chairs. Okay, perfect.
It's actually, it's going to go through the main email. So this is really important because of public meeting law, because of public meeting law, freedom of information requests.
Okay.
We don't want to tie up your personal consulting inbox with that. So if folks have feedback after today, it is so welcome.
Yes.
And the email you would send it to is uhpgb.info@dcbs.oregon.gov, which is the email address you've probably already been coordinating with and where you get agendas and things like that. So you can just,
Michelle.
Yeah, absolutely. You can just notate in there that it's for Diana and it'll get routed right to her.
Thank you. Apologies for confusing things. Don't email me. email the right place and I'll get it. Thank you. Colin.
Diana, could you give an example of a crisp question?
Yeah. Well, without seeing the plan. And so a crisp question, or first I'll say what is it? What do you think of this? What do you think of this? Right. So that to me is not, I'm going to make this up. So we have heard that a number of people, reducing administrative burden on providers could be a benefit. Say that that's what people will propose, some reduction of administrative burden through a universal plan. We've heard reducing administrative burden is important. Here's a proposal for how that would happen. Is this given your experience, is this an effective approach to reduce administrative burden? What would be the trade-offs of this approach? What would be the benefits and what would be the challenges? What are there unintended consequences from this particular approach on reducing administrative burden? So that's, and Colin, I think we'll have to be really mindful of how in the details do we want to get. And part of that will be tailoring to who are we talking to. So we're probably not going to ask a question about provider burden to employers, right? But we're going to we might ask that question to providers or insurers. So is that helpful? And again, without knowing what the plan looks like, but it's both, maybe this would say is crisp and tailored depending upon the group. That's helpful. Thank you. Okay. And again, you can let me know if you have more. I'd like to go back down to the question slide, please. So want to hear about your worries or concerns. I think there's a lot of opportunity, and I've been listening to all of you talk about the excitement, and I think this is how we do things in Oregon, and it's one of the reasons I am here, because that community engagement piece and really trying to do authentic work with groups. What are your concerns? What challenges do you foresee? Michelle.
I'll say from reading the task force community engagement reports from the great work that they did, I saw that insurers refused to even engage. And I have a concern about that. I think that my hope is that we can get folks to the table. And I think that there are some challenges, and I think that we need more people than are already at the table to do this work. So I think that's one of the challenges I see.
Colin.
Hi. My worry is that somehow we will miss people, even with us all trying as hard as we can, because the task force missed people. I mean, I would say most Oregonians don't know this is happening, and it affects every Oregonian, or it can affect every Oregonian. So yeah. And I guess more of like another concern is that I personally, if I had my magic wand, we have like 400 days until March 2026. And so that's 400 opportunities to have in-person sessions talking to people. But I know that we're not going to have 400. So somewhere between a minimum of 10 engagement opportunities and 400 days, there's something to land on as far as like the in-person opportunities to talk to Oregonians. So yeah.
Thanks, Colin. John. Oh, John, you're on mute, for me at least. I still can't hear you.
How about now?
Go for it.
Oh, I was just going to say, this is might be a kind of a related item to Colin's concern as well as Michelle's, but for example, the earlier slide where we talked about focusing on the focused areas of engagement per the legislation, healthcare consumers, obviously that's a very enormous, kind of vast and diverse population of healthcare consumers from, let's say, senior age consumers and consumers of all ages and different backgrounds, as well as geography. So I guess going back to Colin's point, I'm assuming that there is a natural limit to what we can accomplish in kind of live speaker mediated type of environments. And so I'm assuming that some of the marketing or outreach around this can maybe go even a layer deeper, either through some other form of communication or engagement, or a greater investment in those kind of in-person or synchronous real-time conversations and opportunities to collect feedback and share information, that it does something to start to address the enormity of the kind of audiences that we need to reach in a relatively short span of time.
John, I really appreciate that. And one of the challenges here is because we have that whole list of groups, right? And healthcare consumers are one of those, like 10 groups. And then, but you are going to do, I believe, broader public engagement. And so is there a way to leverage that? I mean, and I'll talk with your co-chairs and board staff about this, but is there a way to sort of pull that out to be this broader public engagement piece rather than 2 focus groups like we'll probably do with small employers? I mean, I'm making that up, but something like that. So I really appreciate that call out from both of you. Craig, so nice to see you, Craig.
Nice to see you again. I won't hold up. Diana was our facilitator for the proposed merger between Safeway, Albertsons, and Kroger. And Diana, that's where I met Diana, and she did an excellent job with her. We met for about 6 months. But anyway, I really enjoyed working with Diana. She's a great person, great enthusiasm. I'm sorry, my question was back to, oh, and by the way, Diana did not pay me to say that. Michelle, you mentioned some group or people did not engage. I heard everything you said, but who's the group that didn't engage? Could you tell me? I apologize for not hearing.
Yeah, this will be a shock, so everyone sit down. This was insurers that did not, there was a specialty forum planned for insurers, and instead of going to have a conversation and a dialogue, they wrote a letter and submitted the letter, and the letter is included in the task force report. So that's what I was referring to.
Thanks, Craig. Mickey.
So my worry is I'm always like, I want to engage people early, but we still have to also wait until we have a product to communicate and engage people with. So that's my worry.
Right, because you don't want to engage people and then not use what they say because it's too late in the process, right? Mickey, is that part of your concern?
No, I'm just thinking like, okay, so the board has to present it to the governor by end of 2026, and we're already at 22. So we have like such a short lead time, it seems like, and so many to touch, and so many touch points. So my only worry is like,
That's fair.
wish we had more time.
Yes, I appreciate that's really helpful. Thank you. I think we'll just do our best with the timelines. Thank you. Jocelyn.
I think one of my worries is accessing like rural Oregonians, just because Oregon is so incredibly spread out. And then, I mean, different rural communities, it's not a one size fits all. So I'm just worried about how we're going to encapsulate their experience without making it just rural Oregon when there is so many different types of communities.
Yes, really appreciate that. And again, that goes to perhaps a broader public engagement strategy. Because again, I expect for employers and business organizations and providers and insurers and the CCOs and CBOs and disability-led organizations, we will be, I hope, very intentional on making sure we're getting rural representation across those groups, but also understanding that it's not one voice, right? Mickey, did you have your hand up again, or was that from before? Okay. Okay. If we go to the next question, and this is actually has come up a couple times, and this is actually my concern, right? That this is, and I wish we could do all of the things that all of us want to do to hear from all the people who live in this state, right? That's not possible, both in terms of time, as Mickey points out, but also just in terms of capacity and resource. And so thinking about how do we balance those capacity and resource limits, and I should have, with the desire to hear from many people and be inclusive, and also be responsive to the legislature with what they have specifically said. You got to listen to these groups, and we need to be on these questions, on these, with these goals. But I would love your wisdom and perspective on how do we balance our desire to be inclusive and hear from as many people with the fact that we're not going to be able to do that, and that we have limitations in capacity and resource. So we'd just love to hear what you all have to say about that, because I want to keep that in mind as we're thinking about a community engagement plan. Amy.
I think kind of thinking about the different phases of this work, and that we're in phase 1 in terms of creating a plan to give to the legislature, and phase 2, the legislature is going to tell us, and the timing will depend on what they do with that plan, with our plan that is our homework to turn it into the legislature by the end of 2025. And then the next part will be the next phase, and we will be getting some direction on when and how that will happen. So I don't know, it helps me to think like we are in create the plan phase. We're not in implementation, and we can't jump to implementation until we turn in the plan to the legislature and get feedback about what they want to do with the plan. And I think it's important for us to continue to not, to stay focused on our deliverable of creating the plan and the community engagement for that piece of it, but also know that our entire political climate has shifted in terms of whatever plan we create will require a Medicaid waiver. So I just, I think that we shouldn't give up and whatever, but we need to just be aware of that, and that stay focused on our deliverable is the creation of the plan. And that's phase 1, and that's where we are right now. I don't know if that helps people. But when I get overwhelmed, then that helps me. You're like, what is our focus?
Great. Amy, helpful, very helpful. Thanks. John.
I guess acknowledging kind of the limits that we've just discussed over the past 20 minutes or so, with regard to, as much as we want to sort of be everywhere all the time and collect feedback from as many of these groups as possible, I guess what I would just add to be as inclusive as possible is maybe creating a structure where citizens, healthcare consumers, others on that list that you shared with us that, again, are legislatively mandated, insurers, employers, and so on, if we create some sort of an intake mechanism that is easy to access, and this goes in line, folks that were here, obviously a couple of meetings ago, we talked about perhaps refashioning the website for the governance board to sort of maybe be a little bit more information forward and sort of engaging, is create some opportunities for healthcare consumers, employers, all those other essential stakeholder groups to submit feedback in other ways above and beyond these planned community engagement sessions, so that we're opening up that pipeline and making it as easily as humanly possible for that feedback to kind of come back to us, and make it literally very attractive, not hard to find, very, very approachable. And maybe there's an opportunity for us to, along that trajectory of engagement, to begin to continually educate those folks, the visitors who interact with us via, let's say, an online forum or a survey field, questionnaire of some kind, whatever it is, to continually educate them about what this overall effort is about and what it is not about. So just a thought.
Really appreciate that. Thank you. Jensina.
I don't have a recommendation on how to effectively accomplish this, but I'd like to see a process for ensuring that the folks we hear from, that we're aware of whether they are speaking to represent themselves or to represent a group of people. And the reason I ask this is because every single community has at least one person who always feels like they speak for that community, but don't necessarily represent the views of the entire community. And so I would like us to at least be aware or mindful as we collect this feedback that just because someone says that maybe they represent all of the visually impaired or all of the, or BIPOCs or something like that, that we don't just take that as a blanket statement that all of the people in that community feel the same way.
I really appreciate that. That's really important. And I think part of that is too, is how we talk to folks when we set up the session and how we report back. So rather than Oregon small businesses think this, it's the folks who participated in the focus group for Oregon small businesses who were this group of people, and this is how they came to participate, said this. So that I agree with you. We can't say that there's a group. We will do our best job, and I'll take businesses, for example, of talking to associations. I mean, and hospitals are a good example. The hospital association would have to do some work with their members to see how representative their views are going to be, right? And again, I would never say all hospitals in Oregon think this about this plan. I'd say the hospital association said their members think this. So thank you. And it's a good reminder for us to be really to be intentional about our language. Michelle.
I am just checking in gently to see if I can take us away to break.
Yeah.
This is a really dynamic group that has a lot to say, as you can tell. So, and these are great questions, Diana. I would say they're crisp.
We're and we are done, and my timing should be crisp, so we should have been done 8 minutes ago. But so here's what I'll say. Thank you. Look forward to working with all of you. I'll be back in January, I think, or February. I can't remember. We have to talk with your chairs and the board staff. But if there's anything else you want to share, feel free, please send it to that email address that Michelle gave you, and it will find its way to me. I'm really grateful to be working with all of you, and grateful for all of you for serving in this capacity. So thanks so much.
And I want to make sure, Jensina, is your hand up from your last comment, or did you want to say more? You're good. Okay. All right. Just before we go to break, I want to make sure we wrapped up that conversation. Thanks.
Thanks, Amy. And thanks so much, Diana. So these numbers are incorrect. We will take 10 minutes thank you to Mark for your flexibility, our next presenter. So we'll come back at 1:40. Thanks, everyone.
It is 1:40, so if people maybe can put their cameras on, just so we know you're back. As we get ready for our next speaker.
I know a few people got kicked out of Zoom.
Oh,
just a minute. Back on.
Okay, I'll wait just a couple minutes for them to log back on. We're going to give it just a couple minutes. A couple people got kicked out of Zoom and are coming back in. But if you're here and on the committee, if you could just maybe put your camera on or put your hand up or somehow indicate that you are back. And Katie, can you kind of let me know if we have everyone back from what you can tell?
Yes, I will let you know. I think we still just need about 1 more minute.
Okay.
Okay, we can go ahead and get started, Amy.
Okay, great. So up next, we have Mark Peterson, who's the Communication Director from the Department of Consumer and Business Services, which is the department that this work, the Universal Health Plan Governance Board, resides in. So I will let Mark take it away with talking us through kind of some basics around communications and communication plans. Mark here with us.
Great, thank you, Amy.
There you are.
Yeah, I was, it was touch and go there for a minute. I accidentally bumped the cord and then suddenly I got logged completely out of our system. So that was a hectic 4.5 minutes that I just spent. So anyway, finally glad to be back on with you all. Like Amy said, my name is Mark Peterson. I'm the communications director here at the Department of Consumer and Business Services. I sit a stone's throw away from Katie and Jenny, so much so that I'm probably bother them because I'm kind of loud sometimes. So I'm sure I'm a bit of an annoyance, but I'm here today to just like Amy said, just talk about basics regarding communications and communications plans. I know you all have a heavy lift, a large task, whatever phrase you want to use with your work going forward. And so hopefully this presentation will be helpful for you as you're doing this work. Next slide. So communications, what is it? Simple terms, I mean, you can find definitions everywhere out there, but it's the active process of exchanging information and ideas, which is good, but what you all are going to be doing isn't just communications. You need to be engaging in effective communications. Effective communications, as you can see on the slide, is the process of exchanging information and ideas so that the message is received and understood with clarity and purpose. So parts of this, this includes plain language, it includes accessibility. You want your audience to be able to understand what you're saying. A good example of this is my son's fiance and I both graduated from the same university, obviously several years apart. I have a speech communication degree. She has a computer science degree. She talks in computer languages that I have no clue what they are. If she was to only discuss things at that level, no way I'd be able to understand her. But which in turn would make that not effective communication. But obviously she doesn't just talk about that kind of stuff, and we can actually carry on a conversation. Next slide. So effective communications. There are 7 C's of effective communication. There's actually quite a few more, depends on whose list you're looking at. But this list comes from Scott Cutlip and Alan Center, who first introduced this checklist in their book, Effective Public Relations. As you can see there, the C's are clear, concise, concrete, correct, coherent, complete, and courteous. Next slide. So we'll go through those here for a few minutes. And sorry, I should have said this at the beginning. If you have any questions, raise your hand. Hopefully I'll see the hand raise. But if you have a question at any time, go ahead and let me know. So clear, pretty self-explanatory. Be clear about your goal or your message. And that probably should say your goal and your message, but concise, get to your point and keep it brief. You don't want to, the best way I put it, and I love my mother with all my heart, but she sometimes tells stories that give way too many details, and it's kind of falls under the concrete as well, and they kind of meander. And it's like, okay, Mom, what are you trying to say? And she, unfortunately for my wife, that's one of the qualities that my mother passed on to me, because I sometimes do that with my wife, and that annoys her to no end. But it's getting to your point and being brief. What is the message you're trying to get across, and be able to get to that as quickly as possible. 3 concrete details, not too many, and vivid facts. That way your message is solid and your audience has a clearer picture of what exactly it is that you're trying to tell them. 4, correct. Make sure that the terms fit the audience's level of education or knowledge. Avoid jargon. No spelling or grammatical errors. If people see that in the work and what you're trying to say, especially the spelling and grammatical errors, it really hurts the message that you're trying to get across. If they don't also understand what you're trying to say, as their level of education or knowledge, for plain language, we try to do between 6th grade and 8th grade reading level for the state. Not always, can't always do that. I'm assuming anytime you added the phrase Universal Health Plan Governance Board to a paragraph, that would kick that grade reading level up quite a bit. But is your overall message doing the best to keep it in the 6 to 8, maybe 10th grade reading level? That way people can understand the message that you're trying to get across. Number 5, coherent. Make it logical, make sure all the points are connected and relevant, and make sure your tone and flow are consistent. You don't want some, if you have a certain thing you're trying to get across, you don't want to like pull some other random like anecdote or fact or whatever if it's not relevant to what this certain messaging that you're trying to get across. Complete. Make sure the audience has everything they need to be informed. That doesn't necessarily mean everything, like every last bit of information, but the information you need them to have to be informed. Make sure that all of your information is relevant. The last one, courteous, be friendly, open, and honest in your communication. No hidden insults or passive aggressive tones. Which I probably should do a better job of that in some of my emails that I send out. But also, keep the reader's viewpoint in mind. When you're putting out messaging, look at it from their point of view. It's like, you may be able to understand it because you're hip deep in it. You're working in this in this realm, you've been working on this document or whatever it might be for quite a long time, you know, have somebody look at it and go, you know, somebody who's not involved in it to look at it and go, do you understand this? Do you not understand this? You know, because this work that you all are doing is so important, you want to make sure that you don't, you know, I guess for lack of a better term, accidentally trip up a little bit on stuff. So you want to make sure that your messaging helps your readers. Next slide. So I get this, I'm asked this every once in a while when I say that I work in communications, and they're like, well, isn't that just like kind of like marketing? And it's like, they're cousins-ish, but they aren't the same. You know, marketing deals with reaching specific audiences, and it tends to be customer-centric and sales-driven. If you're trying to sell people, you know, if Kia puts out a commercial trying to sell you the new Sorento, that's marketing. You know, they want you to go purchase their new vehicle. Communications focuses more on the message to the audiences. With communications, you're trying to help the audience understand that product or service. For an example, a government agency running a public health campaign might use strategic communications to educate the public about a new health initiative. But the agency might also use strategic marketing to promote the campaign and encourage people to take action. So I see communications more of the here's what this is part, the explanation of what it is, while marketing kind of falls into the, isn't it great? You know, you should get tested, you should sign up, you should do these different things. That's what that part would be. Next slide. So communications plan. You know, so, you know, what is it exactly? So, you know, as it says there, it's a strategic document that can outline an organization's objectives, key messages, the channels that they're going to use, and communications activities. And what makes it so important is it helps everyone in your organization to be on the same page as to what you're going to communicate about and how you're going to communicate about it. It can prevent or mitigate the effect of potential crises. And that should probably say, can possibly prevent or mitigate the effect of potential crises. Crises sometimes just happen. I mean, as much as you plan, things can just happen. So you just need to be able to pivot quickly in order to, you know, if it's not something you've anticipated that you might have this issue, if that issue comes up, you can pivot and hopefully mitigate that issue. Also, a communications plan ensures that the information is shared effectively and efficiently. Go ahead and stay on that previous slide. So here at DCBS, we've done internal communications plans. We've done external communications plans. We've had communications plans that have been internal and external, you know, basically a combined one. I don't know with the work that you all are doing that you would necessarily need an internal communications plan, because even if you were talking with other government, you know, like government agencies or something like that, I think it would probably still be an external plan. But in case that comes up, in case you need, you know, for whatever reason, need an internal communications plan for this committee or the other committees or the board itself or something, you can do, you know, obviously you can do internal communications plans that are focused on the messaging for them. Okay, go ahead and next slide, please. So creating a communications plan. We have 9 steps, and the research I was doing online, I saw everything from like, oh, here's 4 steps. You only need 4 steps to do a communications plan. And I've seen others that were like, here's the top 17 things you need. And it's just like, oh my goodness. So I tried to get it to 9, because I think 9 encapsulates it the best. So number 1, establish your goals. What are you trying to accomplish with this communications plan? You need that before, I mean, it's obviously number 1 for a reason. You need that before you get to any of these other parts. Identify your audiences. I mean, who exactly needs to get your message? And message and messages. And so it's important to know, and it is audiences, it is plural, because you won't have the same message for everybody. You might have for, multiple groups, but you won't necessarily have it for everyone, just one type of messaging. So do a SWOT analysis. Has anyone done a SWOT analysis? Try to find your strengths, weaknesses, opportunities, and threats. I try to stay away from these as much as possible, but they are actually a good thing to do. It's determining basically, where are you at right now? What are the strong points you have? What are any, the weaknesses? It's like, the opportunities, like, and then threats themselves. So the threats meaning, like, what could cause this communications plan to not be effective? Is there anything out there, external or internal factors that could cause issues for us? So by doing this analysis, it allows you to get a fuller picture of what needs to be done and what things in that communications plan that you may not have necessarily thought of before doing this to help you move forward. Number 4, plan and design your key messages. So what do you want to say? Exactly what are you wanting to say to each of the different groups that you have? Number 5, consider your resources. Can you handle it with the resources you have, with the people that are on this committee, or with the board or whatever, or are you going to need help? It's not a bad thing if you don't have the resources to do everything. If you need outside help, get outside help. Next slide. Number 6, determine the communications channels that you want to use. What is the best way to get your messaging to your audiences? You'll most likely need multiple ways, because if you just think generationally, from baby boomers down to Gen Z, and I'm not even sure whatever the one is after that. Sorry, my kids are Gen Z, so I don't know exactly what the next one is. But they're not going to take in information the same way. So, like, for example, Facebook may work for some. If we're just talking social media, Instagram is going to work for others. X might work for some. Even now, Blue Sky might work for other people. So it's determining, if you can, talk to the media, do email messaging, create printed publications that if you are doing outreach at, if you're having town halls or something like that you can take, so people can take that information home, and as well as presentations themselves. Number 7, create a tactical outreach plan. So basically what this means is, write it all down, type it all out. It's like, it's literally, forgive the phrase, it's the phrase that I've used when it comes to writing, but that's from me having 30 some years of writing experience. It's vomiting it all on the page, just getting it all down, and then, sorry, this is actually grosser than I thought it would be, and then cleaning it all up once you have it down on the page. So it's trying to just get it all down there and then see where you're at and see if that's, you're going to probably need to revise and all that kind of stuff. Number 8, specify a timeline for moving forward. Obviously, for a universal health plan, there is a date. So, so you will, obviously you will want to work back from that date, number 1, but also any other deadlines that might already be instituted, as well as any deadlines that you know that you need to do internally to meet those deadlines that happen along the way. And then lastly, number 9, decide how you'll evaluate the plan and adjust it as needed. How will you know if the plan is working? What steps will you take to figure that out? And if it isn't working, what are you going to do? How are you going to fix that? How are you going to adjust to make sure that the plan is working as well as that your messaging is getting out to people? Next slide. So this is a very, 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 very simple communications plan. A communications plan can be done in different ways. This is literally a table. In theory, this would be something you could do in Excel to make it look like this. But I mean, I've written some that have been in as an Excel document. I've done some that are literally just almost like a narrative in like a Word document. There's many different ways to do it. And so, it truly is however you think it would work best. Like for example, this one, across the top, audience deliverable timeline, description, delivery methods, and who the owner is. I know with our communications plan right now, regarding the DCBS just did a strategic plan, and so we have a communications plan written by one of the folks here at the agency, and it's in a Excel document, so it looks more like this. That way you can look, okay, which ones do we have a timeline of that might be Q2 2025 that we need to make sure that we get done. And sometimes that can be easier for folks. And the important thing is that whatever format you use the format that makes it easy to understand and easy to document the progress for those who will be executing the plan. This plan isn't necessarily going to be, you're not going to give the plan out to external people. So make sure whatever format you use works best for you all. That way you can document and it's easy for you to understand. And next slide, which is the famous questions. Here's my information slide. So does anybody have any questions? Sorry, I talk fast, so forgive me for that. But does anyone have any questions? Okay, cool. Well, thank you. You were really easy on me, so I appreciate that. So I either bored you or what I said made sense. So either way, that means I'm done. So thank you all. I appreciate your time. And if any of you have any questions, my email information is there, or ask Jenny or Katie, and they can get a hold of me. I'm more than happy to come back and talk to you all if you have questions later. But thank you for inviting me to come to speak to you all today.
Thanks so much, Mark. And that tees us up really well.
Craig, were you waving your hand that you had a question, or were you waving goodbye?
I was waving goodbye. Sorry.
Oh, okay. All right.
Thank you, Craig.
Okay.
Thanks for that, Amy. Thanks for checking. And
Take
thanks,
care, everyone.
Mark. Take care. So that tees us up really well for our communications planning discussion. And again, just for context, it was really gracious of Mark to spend time with us today. The communications team, the kind of in-house communications team that is embedded in the Oregon Department of Consumer and Business Services, or lovingly referred to as DCBS, which is where the legislature chose to house the Universal Health Plan Governance Board, is available to us within their capacity constraints. That said, I think that, so that's why, we invited Mark today, because this is one resource, again, within their constraints, that we can avail ourselves of if we need some extra support. That said, we also do have some budget and flexibility to do contracting with communications folks, communications consultants, kind of like what Diana is doing for us. And we know that the DCBS team has a lot on their plate. So that was, that's how Mark fits in with our work, and as one resource, but we're also in the process of scanning for communications contract folks as well. So just wanted to create that context. So for all of that communications work, which is one of our work streams as a committee, and I think one of the ways that we'll get to answering some of those larger questions we were wrestling with earlier about, we can't talk in person, unfortunately, with every person in the state. And so can we leverage some communications resources that can then be accessible and shareable, that can be much more widely distributed to help make more folks aware of their opportunity to give input and also of what's going on and how it could impact them. Amy?
Yeah, I just wanted to also talk about the messaging part of communications, which is going to be absolutely key for us to be successful in this work. Is part of what we really will be looking for in a consultant, somebody that has some understanding and awareness of the tasks that we have ahead, in trying to communicate the various stages of this plan and awareness about universal health care, those kinds of things, and really helping us with the messaging. And one of the things that comes to mind, and another resource that we can have staff share out, hopefully, is I attended in June the Healthcare for All Oregon conference, and they had a panel that involved a polling company and a communications person, and that's one of the names that I've put forward for staff to consider. But for example, the polling company, and Colin, I'm sure you were there, and so correct me if I'm not saying this right. Oh, you weren't there? Okay, but there's a recording that I'm going to ask staff to share with this committee, because I think it's just important. It's just helpful background. But the polling company had done some polling around health in general, and I believe concept of universal health care. And one of the things that came out was like single payer does not poll well. So like that gets into messaging, right? Like what language are we using in our messaging? So I just want to give that as an example and why we really want expertise to support us in this work.
I think that takes us to agenda number 9. Jenny, is that? Oh, are we skipping communications planning discussion?
The communications planning discussion was follow-up to Mark's presentation. So sort of leading the group, and Michelle, I think what you and Amy shared in terms of what we would be looking for in the future in terms of consultants, but also having a conversation and allowing the committee members to share, like, what to use sort of in the same vein as what we talked about with Diana. What are the key issues that you think as a committee we need to be communicating, and the key ideas? We'll obviously be communicating on the plan elements that are provided to us, but sort of in the same vein as what community engagement, what are our hopes? And in Mark's presentation, he highlighted sort of the goals of of the outreach that we do and the communications we do. What are our goals around communications as we start to look both for a consultant and as we start to look at putting together our communications plan? Colin, go ahead.
Yeah, I guess I have two questions right now. Is there that sort of grid that Mark shared? I assume perhaps that we have something that's been a little fleshed out that we can build from, meaning like the owner of the communication of small business, right? It's like 2 slides up, but like the owner of that is DCBS and you, the governance board and the communications committee, right? And I assume this, do we have, is this what we have, or do we have something that's, filled out with like a starting place?
We haven't started a communications plan as of yet because we want to get the committee's input in terms of what it is the committee's looking for in building a communications plan. This is a great example and a starting point that Mark has given us in terms of here's 9 factors that you should build into your plan, and here's a way to set your plan up. I think that bringing on a communications consultant, we'll be able to utilize them to have them help us build our plan, but deciding on some of those key factors ahead of time, since we're still trying to get someone on board for that, is some work that the committee could start doing now. Does that answer the question? I'm not sure I answered the question. I think I did.
No, that's good. Yeah, thank you. Cool. Is that what we want to spend our time doing this moment? Like trying to like spitball some ways to fill in this grid or whatever. And I guess the other question or comment that I wanted to I hope to express to people that I communicate with that everything is still in motion, right? It's going to be kind of a constant feedback loop between communications and the rest of the plan as it's developed. So anyway, that seems like something important to sort of like center that, like, we're not saying anything that's set in stone. It's all being developed as we talk about it. You know.
Yeah, that's absolutely true. Sorry, did I speak over you, Jenny?
Oh, it was me. I just want to make sure people knew that this first line is just a example, not like it hasn't been fleshed out yet. Like even in that first line of small businesses, I think it was just an example, unless staff gave input on that. Yeah, so it's just an example, but we need to do the work to dig into it, just like Colin suggested. That's all.
Yeah, and I think that also Mark gave us a really detailed kind of inside look at like what the work of developing the communications plan is. I think what we were hoping to do with this question was step back a little bit and say, before we get too far down the road in selecting a communications consultant that will really come, just like Diana is doing, come and get input from you all on specific questions, build a draft communications plan, bring it back for feedback, help us implement it. We're hoping to do that same process with a consultant. So we won't, I think we would need many more meetings than we have to build out a communications plan in real time on our public meetings. We're all kind of at a high level, like informing and reviewing and giving feedback and that sort of thing. So I think the question that we were hoping to get input from you all, now that you understand like what all goes into this work that we're trying to identify someone to do, like, is there anything you think is really critical that we look for someone who has this particular set of expertise or this particular skill set, or maybe you've worked with someone or seen communications you thought were really effective? Like, do you have any recommendations for that search for the person who will do this work with and for us? Does that help?
Yeah, I feel some clarity. Something that's just coming to mind, and since this is the discussion part of it, I think that there's going to be a lot of change in the next couple of years, especially with as far as media and community, as far as media goes, I guess is what I'm trying to say. And based on the last election cycle, it seemed like there was a lot of opportunity in sort of alternative forms of media, including like podcasts and that kind of space. I don't know really anything about that, but perhaps somebody who's not afraid to engage with what 3 years ago would have been strange communications pathways. Like, I think now we should not discount them.
Yeah, Jensina, please.
I think Colin brings up a really good point. And I think in addition to that, we would want somebody who is sensitive enough to understand which voices are going to feel silenced by the incoming administration, and make sure that room is made for them to be able to come to the table and speak openly, because there are several groups of people who just after the election are currently planning to take a lower profile. And for something like this, those are exactly the voices that we do need at the table.
Such an important point. Thank you. Mickey.
I apologize, I might have missed this. For the consultant, we have to do an RFP at some point first, or do we have to do an RFP?
We won't need to do a full RFP. It's a much smaller contract, so it won't be the procurement sort of timeline that RFPs are on. It'll be we're looking for someone who has a price agreement with the state so that we can contract more quickly, or looking for a small contract that doesn't take as much time, because it won't be a enormous in terms of like state procurement contracting. It won't be an enormous contract.
Okay, cool.
But yes, we'll be looking for someone, if that was the question.
Yeah, and and then I'm brainstorming it in my head, and I have some people I have in mind that I go to them first and go, would this be something you'd be interested in, before I even bring them to you? So I was wondering if there was an RFP process, which would be so laborious, but so that's nice it's not. Thank you.
So yeah, I think if you have names after you feel people out, if you send them to staff, then is that right, Jenny? That would be helpful if people had suggested folks
If we have,
to explore.
if there are firms or individuals that people have worked with previously, if we do end up doing an RFP and not just a smaller procurement that we can do within what's available to the state, we can ensure that when we release this small procurement, that it is provided directly to those individuals.
So
conflict laws that we have to make sure that we don't overstep. So we wouldn't be asking them to apply, we would just be notifying them of the process.
So if you have people in mind, maybe knowing if they're already set up in the Oregon BIES system, which is already approved, in the state system consultants. Is that right, Jenny? Like that's kind of that.
Oh, and
that
if they're
helps.
not, then don't even bother. If they're not, then don't even bother.
Oh, no. We the state can contract with anyone. It's if they already have a contract with the state, there's a shorter process. But
Anybody.
They would be able to submit an application. They would have to go through the process.
They'll have to go through that process.
Got it. Okay. Thank you for the clarification.
Yes.
Go ahead, Grace.
Thank you. When thinking about a communications plan discussion, to me, two things come to mind. The first is feedback mechanisms and communication channels. So, like, what type of feedback mechanisms does the group see us doing, and how often? And to me, one example that comes to mind that I thought was really successful was Representative Reynolds, who is now Senator Reynolds, is doing a Momnibus package, which is a package of bills to support maternal health care. And in doing so, she's been hosting town hall sessions where it's upwards of sometimes 160 to 200 community members attending virtually. And you know, it's a widespread blanket slate of information. And I think in particular for this committee, I think having a town hall with action items at the end or interactive data collection, like there are some really fun websites where we can collect data that feels a lot easier to collect people of the same group. So like inviting coalitions to a town hall to implement like some fun interactive data collection that we would predetermine beforehand. And then lastly, just communication channels, things that are replicable, which was kind of already touched on by Colin. So like the podcast and things like that, and just ending each communication channel with an action item, you know, here's what we want feedback on, and here's the foundation so you understand kind of the information.
Thanks for that feedback, Grace. That's great. I think that, you know, one of the big challenges that we face is time, and we're embedded in a state government that isn't designed for speed. And so finding, you know, being able to provide as much front load anyone that we're contracting with as much context and information from the committee as possible, I think will be really helpful. So appreciate that. Looking at the clock, are there any more comments on this item? And of course, like all of our discussion items, if you think of something at 3 o'clock in the morning, send an email. If you think of something next month, this is going to be, you know, when we're onboarding a new communications consultant, these opportunities will still be here for input. So this is not like this is the beginning of a long conversation, is I guess what I'm saying. Not the end of it. Great. So that brings us to reflections on this meeting and also prioritization of future topics. So one thing that we already have, just reflecting back from an earlier comment in this meeting, I believe from Jensina, is a timeline, looking at our work plan in terms of a timeline. Are there other reflections that y'all have about this meeting and what worked or what could be improved, and also future topics that you would like to see as we move into the new year together?
I just want to close the loop for, I think, Jocelyn, you were interested in that OHP member listening session on CCOs. It's Tuesday, December 12th, 12:30 to 1:30, and I sent staff the OHA email that they can send out to the group
Thanks,
with
Amy.
the Zoom information and all that.
Jensina.
Amy, can I get clarification on that date? December 12th is tomorrow.
Oh, thank you for clarifying. I wonder, okay, let me just look at the email real quick. Does it have the wrong? Oh, it is tomorrow. I was thinking it was next Tuesday. It is tomorrow. Sorry about that. So yes, we will send that out right after the meeting, hopefully. Thank you for catching that.
Nikki, and then Colin.
Yeah, so I was wondering if you think there would be value in also checking out other states who are doing some similar work in their communication and engagement process or whatever work they have to date. I watched the legislative days today where a couple of the board members presented, and they were saying that they are engaged with other states as well who are engaged in this kind of process. And I wonder for the communication part and engagement part, I wonder if there's something we could learn from others on what they're doing already.
That's a great question. Jenny, I know you did a lot of that scan. So I don't know if you already know, or if you just have contacts that we could ask.
So we have, oh, sorry, go ahead.
Oh, I just want to say, and staff will also send that recording of our board chair and vice chair presenting this morning at the pre-session legislative days, so that you can all see that as well.
And so, Mickey, to your question, we do have regular communication with both California and Washington on their efforts there. We haven't actually talked about communications plans. We've been talking a little bit more about some of the policy and plan design elements, but I can definitely bring that up with them and see if we can get some information from them on, I know they don't have, neither of them have committees dedicated to it, but I'm not sure if they have communications plan that staff works on, or if there is other outreach that they do, but I'm happy to look into it.
Great. Thank you so much.
Thanks, Jenny. And yeah, great question, Mickey. Go ahead, Colin.
To bounce back off the California and Washington thing, that sounds pretty interesting to try to include. It'd be great to have somebody from California or Washington attend, well, maybe the governance board or this meeting, and just somebody could offer something. I think there'd be some value somewhere in that. I guess I still have a question on, I know that's just an example of the that spreadsheet that we looked at a second ago with that example communications plan, is an idea that some of us should send information to Katie about what our thoughts are, or Amy and Michelle, are you going to flesh out that thing, or are we going to wait for the communications consultant? Or I know that's just an example like spreadsheet, but that in my mind, that's like the thing to do. So is something going to happen with that?
I think the question, as far as I know, and staff, you can correct me, is there will be something like that, but likely the communications consultant that we hire will have a slightly different, each one will have a slightly different process. So it'll cover the same basic principles and elements, but it might be a completely different format. So I would say if that like got sparked something, and there are thoughts that you want to put down on paper, digital, or otherwise, and send it in, that we could certainly share that with the communications consultant when they are hired and onboarded. And also, regardless, I think that the communications consultant will have a process in which they'll want to include feedback from all of you. They'll be bringing drafts for feedback. And it'll be like a back and forth process between them going away and doing work, bringing it to us, sending us drafts, those types of things. But if there's anything that's sparking right now, we would love to hear that. It's not something that I would try to duplicate as a co-chair ahead of hiring an expert, because I think that it is a very specific skill set. And so, but yes, I think any initial thoughts that sparked that you want to send, we can certainly incorporate and provide that to the consultant. Does that answer your question? Great, thank you. Jensina.
I would love to see some specific tasks arising. For example, we'll send in some suggestions of organizations that should be hearing from us. So I would love to see some more action plans as far as who do we contact at these organizations, who's reaching out to them, has any outreach begun? Like, has anybody asked them yet if they're even open to having a conversation, or what's the best way to communicate with them? Do they want an email? Do they want a phone call? Do they want a forum, or things like that? We've learned a whole lot about what the Universal Health Plan Governance Board and the various consultants are doing to help us. I know, for speaking just for me personally, I'm a very action-oriented person, and it's very challenging for me to sit through presentations without having an idea of what the call to action is for me.
Yeah, I certainly hear that. And this is there are folks on this committee that are used to probably much more grassroots, like just move into action type of processes. And that is one of the constraints of doing an inside track process inside of government, is that there are more process constraints. And this body, it'll be interesting to me to see like when forums are planned. I think we can certainly all be there. I plan to be there to listen when appropriate. And this is the group that does the planning. This is the group that does the informing, the directing. Like, this isn't necessarily I don't know that it's envisioned that this group will ever go out and divide up that list of outreach and everyone will call 10 people and we'll come back, right? Like, it's a much higher level process that we're engaged in collectively. So we guide the work, we inform the work, we evaluate the work, we ask questions about the work. And we're not necessarily the folks that are tasked with doing all of the individual outreach engagements, if that makes sense. That said, once we have communications materials drafted and once we have plan elements, we can all in our individual capacities be talking with folks around the state and making sure folks are aware of this, the resources that are being developed. But I think that the role that we have is to like really take that work plan and make sure that it's running smoothly, make sure that it's on track, make sure that it's inclusive, make sure that it's, you know, happening in a way that's equitable and that the product that's being delivered on behalf of Oregonians to the legislature reflects a robust process that's rooted in our values and principles. So I think we can certainly look for and talk about what the opportunities are for each of us as individuals to play more active roles. And I think with 14 members in this inside process, I think that might be that might not be where all of the work is happening. Like, it's really, the design was that in these meetings, we would be the kind of the oversight body for community engagement and communications work to guide the work more than the doers of the work, if that makes sense. And Amy and staff, I don't know if I'm missing something or if you have other perspectives to share, because I think it's a really good question.
I guess one of my thoughts is I think this committee is kind of heavier on people who are more kind of community engagement, advocate, community-based organization connections, you know, myself, Michelle included. That's why we wanted to be on this committee. And that it's really important for us to remember that the groups that we are tasked with engaging with, and the messaging around that is heavier on small business, healthcare. I mean, not heavier, but there's all these very important groups. And what I have to keep reminding myself is, you know, we need to think about how often we are going out to ask for input and community engagement, and that we also need to keep in mind the importance of the engagement with the groups that we're tasked with engaging with that have paid lobbyists, for example, that may try to block our work and things like that, and the importance of us doing really figuring out how do we get people to the table, you know, that didn't come to the table with the task force, if that makes sense. So kind of a lot of our work needs to be really strategic around that.
Go ahead, Jenny, and then maybe we can circle back, Jensine, if you have additional thoughts.
I was just gonna say, I think both Michelle and Amy nailed in terms of what the process and what the intent for the committee is. And I think something that is certainly difficult when we have a very action-oriented committee is that one of the really the primary objective is for us to take the plan design elements, the finance and revenue elements, and go out and educate specific groups about the work that's being done by the board in terms of those very specific elements, to get their feedback and to really work with them to see if we can come to, you know, a place where they're giving us input and feedback that's useful to the plan, the design of the plan, and the design of the financing system. And working in an environment where we're waiting for that information to come makes it very difficult for individuals who really want to be active to go out and have something to start to talk about. I think Colin's mentioned it a few times that, you know, just alerting people to the fact that the UHPGB exists and that it's out there working is something that we can continue to do right now, and to try and drive some public engagement with the board in terms of watching the board, providing public comment, and being engaged with the board. But until we start to have some actual information to educate the individuals that we're tasked with speaking to about, a lot of it is that sort of learning phase and that building of the plans and the building of the strategy phase, which I acknowledge can feel a little bit frustrating too, especially to us knowing that there's a lot of engagement that needs to happen. I understand the frustration that we're not engaging already, but we're sort of waiting for the information that we need to engage on.
Tinsine, I know that you had your hand up for a while and then you put it down. Did you have like additional comments or
No,
thoughts?
I just realized it was still up.
Oh, okay. Okay. Yeah, I think that that's a great question, and I think it's something we'll continue to wrestle with. I will say, if there are people in your community right now who are hungry for this conversation, there is a one-pager that the task force put together that exists. And I think it helps me to remember that we're not the beginning of the engagement. Like, there is a bunch of engagement that did happen, and that there is an entire engagement report from the task force, and that was really focused and targeted on communities most harmed by our current systems. And we won't be the end of the process either. We're kind of midstream. And basically the legislature, I liked your analogy, Amy, of homework. The legislature said, this is your homework. These are the resources and the time that we're giving you to do it. And I guess the responsibility that I feel is, if we do our piece well, then the project will have another layer of that foundation, and it can continue to be invested in, right? The state, I think, would be more likely to see the value in continuing to invest in the next step, in the next phase of this work. So we're kind of midstream. We've been given really specific things to do. And I think if we can do that well, it will build on the good work that's already happened, including those wonderful listening sessions and forums that happened with a lot of specific communities in the last couple of years. So that's one piece of context that I think is helpful. Like, we're not starting from scratch. We're like actually midstream in a long engagement process. And then all of the engagement that needs to happen for this to be successful is not going to happen by the board or its subcommittees either. So again, I think one of the things I'm hopeful for in this process is that we will develop more materials. Like that, I've looked, those one-pagers that the task force created are solid gold. There's so many more of those types of things that need to be created. And I think we have an opportunity to build a toolkit that advocates can use in grassroots settings to spread the word about this work and foster more engagement. So I hope that helps. Yeah, go ahead, Amy.
I was just going to ask if staff can I don't know. I don't think that we've shared specifically those tools that Michelle referenced, but it might be helpful for the group just to see them, to know what, kind of what has happened, what was part of that process.
Yeah, the community engagement report specifically from the task force, I think, would be helpful to share, as well as the one pager, which is, I think, only available in English and Spanish at this point. Thanks, Amy.
Yes, I will include those in the follow-up materials.
Thanks, Katie. Any other reflections, questions, or future topics? We do have a couple of suggestions for future topics, but I think we have all of 2025's meetings where we could incorporate feedback. So we'll have this agenda item at the end of every meeting, but if there are any other thoughts out there, it'd be great to just capture them real quick. And if not, I want to thank everyone again for another dynamic discussion meeting. Y'all are so engaged. So really appreciate the opportunity to hear your reflections, hear your questions, and hear your suggestions in every meeting. We don't have any public comment today, so I'm going to pass it back to Amy.
Yeah, I just want to thank everyone for coming. Our next meeting, staff correct me, January 22nd, correct? So we will see you all back here. And in the meantime, yes, please communicate, you know, thoughts that you have after the meeting, and then help us build that next agenda.
And then also just to remind everyone that starting in January, the meetings will be moved to 1 p.m.
Thanks, everyone.
Thank you. Happy holidays.
Thank you.
Thank you. Bye.
Bye.